So, what is energetic manual therapy? It's a specialty class within Access Consciousness that I have been creating for quite a few years now, and it's body work, hands-on body work that targets the fascial system with all the tools of access. And I started working with bodies with the access tools like almost 20 years ago now, when I first walked them into my first access class. And these amazing questions and ways of listening and accessing the consciousness of everything around you without judgment started changing everything I was doing with bodies. Like truly creating a different possibility. I was able to hear bodies differently, perceive what was going on with them, know what they could change, know what they wouldn't be willing to change, and where to go to actually create something that could change greater than most of us could ever imagine. And I started getting results with bodies that were like, what? Is this actually possible? And I worked on thousands of bodies, taught the 3-day body class, thousands of people, and been teaching EMT around the world now for about 5 years. So we had a little lull for a couple years. You hear some background sound? And so the bodies that I worked on showed me what this work is. Now, before I walked into an access class and got this energy about being a question with bodies, is everything okay?
Yeah, everything's
Okay, because I can hear like a video or audio or something.
Because the translator is speaking.
Oh, okay. Okay, we have translator background noise. Where was I going? So the body started to show me what this work was. So before I ever walked into an access class, I was working, I'm a physical therapist, I have a doctorate in physical therapy, and my practice was primarily fascia-based. I was doing a lot of work addressing and targeting the fascia, and I've been trained in a lot of that work. So that was my primary way I worked with bodies, and this changed everything. And the body started showing me this different way of being with them, how to create different possibilities, how to create change that I'd never imagined possible. You know, I had when I started adding the access tools, people would get a session from me, and the next time I saw them, they'd almost leap into my arms going, oh my God, you gave me my life back. Now these would be physical therapy patients, clients that had a lot of pain, and we were creating amazing changes with that. But I was also giving them access to their bodies in a new way, creating more space, more possibilities, and more consciousness and creation with their bodies. So the things that were difficult for them previously were changing, and it wasn't as difficult, and they were getting their lives back, is what they would say. So what is fascia? What is this marvelous, miraculous system in the body? And I know right now in this reality, it's very popular. You probably, maybe you have heard of fascia. A lot of people have. If you Google it, there's YouTube videos, there's millions of practitioners doing lots of stuff with it. When I started working with it, it was weird, and it's been researched a lot. It's in research, medical research, it's very exciting because it's kind of this new frontier no one spent a lot of time with. So fascia is your connective tissue. It's the connective tissue of the entire body. What does that mean? It's considered the organ of form. So the form and shape of your body is created with your fascia. It gives you, it's why your liver is where your liver is, and it doesn't drop down to your leg. It holds everything in place, separates, contains, and it supports everything. Everything is suspended in this body that's this fascial body. It means like if you dissolved everything in your body that was not fascia, you'd still pretty much look the same. Come on around, guys. Come into my view. Nice to see people. I've got people coming in the room. So you would still look pretty much the same. You'd just be translucent, like say a jellyfish, which is mostly just a fascial organism without a lot of other stuff going on. And it's like translucent. So you would still look the same. Like everything would still be there. Your liver shape would still be there. Your brain would still be there. Your eyelashes, everything. It just would be translucent fascial tissue that would be there. Because your fascia surrounds every DNA, goes out to the cell walls, surrounds your cell walls, supports your cells, your cell walls. It's called the microtubules of the cellular system there. And then it goes out to becoming very, very dense tissue when it's your tendons and your ligaments. Fascia is incredibly strong. Now, why am I mentioning that? It's very, very strong, and it can't be deformed easily. Its design is to maintain your form, not to be mushed and stretched around. Like I can't push into my arm and leave a dent. It comes back because the fascia is designed to continually keep your body in the form you're creating. It's also transforming all the time. It's not a structure. It's not a static system. It's always changing and morphing and making new connections. There are live videos. There's a wonderful one called Strolling Under the Skin, which is kind of like the best fascia video out there, which is, anyone's welcome to watch that. We can put it in the link if you want to see it live. So it's not a structure. It's a system that's always changing, but it's maintaining the form, the structure and form of your body. And it can't be, the form isn't, you can't change it by stretching it, by cracking it, by forcing it, and it's so strong that often your bones will break before your tendons and ligaments will do an injury. So it's really strong tissue because it's designed to maintain the shape of your body. As you run down the road, you get in a car accident, you don't fall apart into pieces unless it's really something horrible. Pot and pock, all of that. So when I started doing Access, they talked about being a question and inviting people to possibilities. And if you're forcing something, if you're forcing change on a person that's not receiving it or doesn't want it, it will, they will resist you and they will push back. And the fascia has that quality. So the Access tools, when I started using them, just started to give me such a different possibility to work and to actually have a better understanding of what I had been doing for years. And like I said, it started to exponentialize. People got greater, they got greater change. So what I'm going to be doing today in this intro is I'm going to get someone from my little audience here. We were just doing a 3-day body class and it's just ended and a few people have hung around, and I'm going to invite someone up on the table. And as I'm working with them, I will be speaking to what this work does and what it changes. And I know there's questions out there, and I don't know if anyone wants to write anything into the chat right now to ask a question. If there are any questions, Amy, do you see any questions out there? No. Yeah, cool. So let's start with getting someone up on the table, because really to see the work that you're gonna, it's subtle work. So I'm putting tension, pressure into the system, into the body with my hands. Not a lot. Usually, it can be though. It depends on the body is always the guide with this work. The body guides the session, and the practitioner follows. They are the leader of the session always, and that's why it's so different than much of the other body work modalities out there. Is because many of them are doing, and EMT is not a doing; it's a creation with the body. It's not a doing to the body. The body has to be speaking to you for this to work well. And you have to be listening. So a lot of this class is enhancing those body whispering skills. Those skills to listen to the body will start getting greater after this class, because it's really essential that the body is showing you, or you're forcing something into a system that's designed to resist force. You cannot force fascia to change. Now people will get fascial adhesions and stuff from accidents, trauma, surgeries, things like that. And the medical profession, the doctors, the surgeons, will go in and cut in the body and cut out fascial adhesions. They do it. I've had patients that have had that done more than once. Problem is that trauma from the surgery now creates more fascial restrictions that add to the ones that removed, and they can just start to grow new ones in different places. So it's not a really effective way to change fascia. This work is really, actually, from what I've seen over the years and the results I've seen, quite effective at changing limitations in the system. What do the limitations come from? Like, how do you get a fascial restriction? Like I said, traumas, injuries, accidents, yes, obvious things. You get cut, you get surgeries, you get in an accident, you break a bone. Those can all create a scarring and a tightening of the fascia. But mostly what it's created is your points of views. Now your point of view creates your reality. Those of you who have been in access classes and no access, some of you may not, it's not a requirement to be on this video, of course, accessconsciousness.com, you can go there and check it out. We speak quite a bit about how your point of view, and your point of view, what is your point of view? It's the awareness of everything. It's everything you grew up with. It's your culture. It's how you look at stuff. It's how you look out of your eyes at the world. It's your experiences and your judgments, often. Now in Access we talk about consciousness is the awareness of everything without judgment. Judgment tends to solidify everything, so you can't see anything that doesn't match it. It also solidifies your body. This work, EMT, can start melting the judgments that create the limitations of bodies. So if you can start changing your point of view about things, even without any body work, you can start changing your body. And many of you who have taken Access classes have seen those results with just a clearing statement, potting something, your body changes. Or you take a body class, an energetic class, where there's no actual manipulation of the body and your body changes. This is not the only way to change a body. It's just another fabulous way that you can use consciousness and tools that create possibilities to work with bodies, to add to whatever it is, or to get, if you come to a class, to get great, amazing 3 days of work on your body that creates changing. So I'm talking about judgment. So let's say you have a judgment that you lose your ability to move freely as you age. Age is a huge judgment that impacts your body. That can start creating you shrinking the whole fascial system. And you see those people with the old people with their walkers, and they're walking around like this, right?
Yeah.
Yeah. That, from what I've found, is just a lot of judgment about what's supposed to happen when you're aging, and it's the fascial system that's shrunk. And everything in the system, which is everything in your body, your heart, your lungs, your bones, your joints, shrink down too. And now you have joints that are too tight and knees that are too tight. You get arthritis, which means joint pain. That's what it means, arthritis. Arth is joint, ritis is swelling, inflammation in Greek or Latin or something. And that's what you get, and you get a diagnosis that your knee hurts when you went in with your knee hurting, and a doctor gives you a knee hurting diagnosis. But he just gives it to you in Roman or Greek words, so you think it's special. But you just told him your knee hurt, and he wrote down arthritis, which means your knee hurt. But that happens often because everything shrinks. Now, if you can just open up that space, just a little teeny bit, if you can open up that knee space, it changes. Now the joints aren't close. Joints don't like to be close to each other. The bones don't like. You got space. You get synovial fluid to flow back in there. You have that natural cushion your body likes to have, and the pain is different. And I do see this all the time. And they have some studies now where they've shown before and after x-rays of the difference in joint spaces. So if people like that kind of stuff, it's out there. Like I said, they've been looking at fascia for about 25 years quite extensively, and there's a whole fascial research society now. This did not exist when I first walked into a myofascial release class years ago. But I knew, without the studies, which you all know without studies, is that it worked. I knew what the results were with my body. When I walked into my first access class, I knew about the changes were so great that I didn't need a research study to show me it was true. But some people like that stuff. So, you know, I'm a little bit of a research geek, so I do have a capacity to look up research and find cool things that contribute to this work. So judgment. If you have a judgment, let's say you don't like the way you look or the way your chest looks, you might like spend a lot of time like this with the judgment, and then your body shrinks down and solidifies that. Now again, what you have to know about fascia is you cannot stretch it. You can't just go, oh, I'm going to have my posture back, because all this is so tight and it's designed to keep the shape and form you judged into place, right? And it has to be invited to a different possibility. Now I say you can't change fascia with stretching. Well, they have been looking at that for years. Stretching does not actually really change much. Doing stretching exercise really doesn't change range of motion. Stretching doesn't work. There were articles that they were talked about when I was in PT school 30-some years ago. Because the fascia part of your muscles and ligaments and tissue, and it's not just muscles and ligaments, everywhere. everywhere, around every cell and organ, wrapped around every nerve, through every nerve, all the walls of everything. It's fascia. Resists is designed to resist stretching. But the cool thing about fascia is it responds to a question. When you are being a question with your body, like what else is possible? Can we change this? What would it take to change? What would it take to change this body is a question. Fascia responds to that. Being forced to lengthen, it resists that. Force does not work with changing fascia very well. Cutting kind of does, but that creates other difficulties. But you might say, oh yeah, a gymnast stretches all the time, or a dancer stretches all the time, and they're so limber. You have to ask, are they being a question with that? Are they training every day to become limber? Like, I need to do the splits on the bar. Body, and they're creating with their body this whole gymnastics lifestyle, training every day with the activities constantly that increase the length of the body from a question, from a demand, from a request. I want to be better at my splits. I want to be better. What would it take to be better at my splits? They might not say it that way, but that's what they're being. They're being that energy all the time. A little different than just going in and I'm going to stretch my hamstrings to touch the floor with this intention of stretching, not an ask and a request of the body to create with you. I'm going to say that again, to create with you. When your body creates with you, when you create with your body, the change is greater. Bodies don't like to be forced. It doesn't really work well when we force it. We're good at it, but this is a lot more effective and creates greater results. Do you guys have a question? I feel like there's a question somewhere. Did someone write in something?
Someone wrote in the chat a comment, but it wasn't a question.
Okay.
That she's a massage therapist working with clients post-surgical procedures and definitely understands scar adhesions and fascial restrictions.
Okay, exactly. Yeah, and I've had I made a lot of money off of that with adhesions and fascial restrictions over the years. Now, this is not a technique you use right after surgery, especially if there's still stitches and the wound hasn't healed. This is not effective at all. It's quite the opposite, but it's pretty obvious when you see what I'm doing that you wouldn't do this over an open wound. If someone has an open wound, if they're not stitched up and haven't come to the doctor, you call an ambulance instead and make sure you stop the bleeding. Totally different world.
Yeah.
Okay. Do we have questions out there? Do you want to take a second for a question?
Right now there's nothing.
Okay, cool. Then let's get some.
There's a question in Spanish thread.
Okay, did they write it in?
Not yet.
Okay.
They just asked if they could ask a question.
I think I'll take a question. I was going to take them after, but I think it'll contribute. Sorry, I'm just seeing what this is. Okay. Who wants to come up? Is it open?
I'm worried that James,
There you are.
I'm not.
Okay. Can someone handle your monitor for questions, your phone?
Yeah, she's doing it. Who's going on too?
Yeah, I understand that. I'm
Sure,
just
I can do
curious
it.
about who can.
So the question is, does the judgment get some relationship with the function of the organ? Like, for example, joints, does the judgment create some effect in the function of the organ?
Well, what do you guys know?
Yes.
¿Qué es lo que tú sabes?
Let me speak to that. Well, we all have heard of, yes, it does. Absolutely, it does. Judgment absolutely affects. And other things you do, like the cirrhosis of the liver is basically the liver creating a lot of fascial restrictions and hardening. I mean, it's one of the things that creates liver failure down the road. I have worked with people that were alcoholics that had cirrhosis of the liver and they were at end stage, and I was doing this work with them in a drug rehab facility, and couple sessions they had their liver function back. Everyone thought it was a miracle, and then they thought it was a doctor's medication that he changed with her, and she knew and I knew that it was not that. You can have the pericardium. It's a sac around the heart. I've worked with people where that is tightened and it's just a fascial sac, and I worked on their chest and their back and through their body, and that opened up and their heart function became better. And anything can create a scar. So the joints is something I work with more as a physical therapist, because someone with arthritis comes to see me. Someone with cardiac problems goes see a cardiologist. They don't tend to, well, we do see them, but it's not, they don't tend to come into my practice. But absolutely, all of your organs are fascial organs with the organ cells in them. So the liver is a fascial organ that, and I mean, all of the liver cells and the blood vessels that go to and from it, and the nerves that go in, are all supported in the system. And the fascia keeps all those cells together. That's how they're, you know, your liver cells aren't floating into weird places, because the fascia connects and supports everything in your body. So yes, every organ. And with the brain, I work with traumatic head injuries, and a lot of them are starting to see that traumatic head injuries is scarring inside the brain, and I've seen changes in that area with this work too. When the fascia gets thicker in the brain, the fluids don't flow through it as well, and this can open up. It can melt the fascia, soften it, create more space, so it's not as dense and tight and hardened. So there is not really anything someone can come to me with, and I wouldn't say, yeah, it could possibly help to open up this space, because then all the cells and the function of whatever those organs are, they can just work better, because they're not in this kind of like, who I trained with before, like an internal straitjacket that keeps everything from moving. Like your vessels flow better, your nerves fire better, your brain is clearer, your heart can have a better function, your liver can. You know, people that have had the stomach surgeries, I've worked with a lot of them with the bariatric, where they stomach staple to reduce the scarring from that, and they've had a lot of ease from vomiting and things they've had. So I've worked with a lot of things that aren't just muscle and bone. Uteruses. Someone just said that. Ovaries. There was a woman who took this class, who worked on a woman that had fibroids or cysts, ovarian cysts, benign ovarian cysts. She did this work, and she sent me a before and after picture. This is a woman from India where the cysts had gone away. I don't know how many sessions she did. I don't have all those details, but there was ultrasounds of the ovaries before and after that changed. And you don't need to be a medical profession to do this. It's not, the skills that I teach in this class are not tricky or not hard. And it's really about being intuitive and following the body and having your perceptual awareness of bodies increased. Sometimes the people that come to my class that haven't had training with bodies are much more receptive and open to receiving it, and do a fabulous, if not sometimes maybe even a better job. And if you do have training, use all of that to your advantage, absolutely. If you spent years studying something, you have that information, that knowledge, and use it to your advantage. Just don't make it an answer, please. Everywhere you've made your training an answer. So you cannot receive a different possibility because it doesn't match the answer and the judgment of your training. Can we destroy and uncreate everything that is, please? Yes. Right, wrong, good, bad, pod, poc, all nine shorts, boys, bullets, and beyonds. Because anything that doesn't match your judgments, you can't see. And that tends to be the biggest blockage I see with people that are trained a lot and think that their modality or their way of doing things isn't the answer, is that those judgments make it really hard for them to see possibilities with other modalities. Now in Access, we're always looking to get out of judgment about everything, so we receive new possibilities that are actually something that will contribute. It's really what contribution can you be and receive from your body that you've never imagined. And everything that doesn't allow that can be destroyed and create it all. Yes. Right, wrong, good, bad, pod, poc, all nine shorts, boys, clothes, and I think I can move a little closer. Yeah? Or wait, maybe. No, you don't move the camera. There. Okay. Amy. I could maybe do both of you.
Yeah. Sure. I'll go first.
Yeah, so if you could get anything out of this quickie.
Yeah, elbow. Go on.
Elbow? What's going on with
Yeah,
your elbow?
so I was pulled off of a bed and landed on my elbow and my back.
Amy, can you speak to the computers? We can't hear you.
Okay, so I was pulled off of a bed and landed on the ground on my back and my elbow is still, like, I've seen a chiropractor and had body work done, and it's not articulating properly, and I just have a lot of pain through the muscles and ligaments, and I'm a massage therapist and I use my hands and arms a lot.
Okay, so I haven't worked or seen this. This is new.
Yeah, it was last year.
Okay.
It was about a year ago.
Anything else? You said your back?
Yeah. but I feel it probably more in my jaw and my neck and this arm
Okay,
and
I'm
shoulder.
just wondering the best way to position you. If you
Now,
want
should I
to be,
be there?
then I'll be in front of you.
Okay.
We'll do this side.
Okay.
Go ahead and lay down. What's that, Arena?
Speak louder.
Are you guys having a hard time hearing me?
Yes, a little bit.
Okay, please let me know.
And if you could speak a little bit slower, that would be
Slower? Okay.
yeah.
Who, me? No. Are you kidding me, Bruno? No posible. Más rápido. So what I'm doing, you can't really see it. Let's switch you around and see if it's better. So what I'm doing right now is what we call an arm pull. So I'm accessing her fascia, because she said it was her elbow. So
Yeah.
what part of the elbow hurts?
So it's like all here and this muscle here, and then I have a lot of pain here
So
too. So it's kind of like my whole
Her
elbow
elbow.
down into my arm.
Okay. And you didn't fracture or break anything?
Nope.
No. So I'm accessing fascia of her whole body through her arm with this.
Should I move the camera a little bit
Maybe.
for the arm?
Yeah.
Maybe. Yeah. And a little in the front of my shoulder too, actually. Now
Okay.
that you're holding my arm.
So her body's starting to show. This is really cool. This lighting's weird. The body. Hold on, we got set changes to go on. That's better. I don't look like I have a bright red white forehead. I'm accessing her body through her fascial system. And it's starting to already talk to me because she mentioned, and now my shoulder, now that you started this, bodies will do that. People will come to me and they haven't had anything going on with their body except for what they've normally been seeing me for. And they'll go, oh my God, my back just started hurting just before I came to see you. And it's like, it's not hurting, it's talking to you. So her shoulder is talking to me. So there's stuff going on with her shoulder also. So what am I doing? I am in the question, what is this body? Show me what you want to change. If you could get anything out of it, what would that be? Is something I always do to start a session. But right now I'm curious about what's going on. I'm watching everything about her. I'm not just working on her arm. Her fascia is her whole body, right? Now, are you guys hearing me okay while I'm doing this? Because I know I'm looking the other way. Sounds okay? All right, so her fascia, her whole body. And I'm also giving the body permission. This is another real different thing about the energetic manual therapy work, is that her body has permission to move however it would like to. I do not want a body that's still on the table. And her arm is already starting to float, is what I'd like to say, this direction. So what you'll see often is the body's, as the fascia releases, the body will start to move. And my job is to let it. I don't want it to be still. Now, not everyone moves right away, but as fascia releases, it'll feel like it's melting. Like someone has described it as like if you had your hand on a cold stick of butter. The butter's real solid and warm, and then it starts to melt.
Yeah.
And you follow the melt. You don't smush it. You let your hand follow the melt. So I'm letting my body work with hers to follow this melting.
And even right now, it's like burning down this line a little bit.
Okay, so she just
So
showed me a
it's-
new spot, so I am following the energy of what she's saying. They're always correct. I'm not putting my point of view into the system. I'm inviting her body to show me what's going on. Now, this is lots of years of doing this,
Yeah.
but when she just pointed at it, that's her body talking to me.
Yeah.
And I'm going to add that in. So I'm just kind of sensing, I don't know if you can see it a little bit on there, on the camera. It's okay, don't move it. You don't need to move it. I'll just move me down that line of tissue, which is actually kind of on her bone here, between the two, the radius and the ulna.
Yeah.
If you want to know anatomic stuff, I'm kind of in the space in between, which is a big fascial sheath that hold them together.
Yeah.
Now there's some rotation happening in her wrist.
Yeah, there's a lot going on in there.
And now her arm's moving more. I'm keeping a hold of this spot. I'm not gonna let go. I'm gonna keep it as long as I can. Stay with this. You may lose.
And now it's like really strong right there.
I'm staying in that same spot. I will more address where she pointed in a bit. Too much?
No.
I don't want it
It's
to really
unwinding.
hurt
It's
or
unwinding.
yeah, I don't want it to be uncomfortable and hurt.
Yeah.
Because then her body will be resisting it.
Okay.
Now it can be uncomfortable, but it's got to be stuff that's something that's contributing.
Yeah.
But if it's too much pain, I need to change my pressures because the body chooses. Is that making sense to everyone?
Yeah. It's not too much.
You guys getting this?
Yeah. It's just showing me the intensity that I have.
Okay, so this is your thing.
Yeah.
So
that's
the
thing.
body's gone
It's
and
showing
unwound itself into
the thing.
her thing.
Yeah.
That's my fascial dance. Because it's hands that dance with bodies, so I'm just showing you. I'm keeping this pressure in here. I can multitask. Now that's changing a little bit. So this is one of the skills you learn as an arm pull. My body weight is doing most of this work. I'm not working very hard. The only thing that's really working is my grip here in my hand. I'm just kind of hanging out. Keeping the pressure and being aware of her body and what's going on and seeing what else changes.
Yeah, it's like melting. Like the intensity
Now
of the
there's-
burn is gone.
And some of you guys may pick this up through the videos, through the ethers, into the cosmos. This area of her wrist just got really loud in my awareness. And I'm starting to put a little bit more pressure. I don't think it comes up in the video, but there is a whiteness, like there's not a lot of coloration here at this part of her wrist. What you'll see is as the fascia starts to melt, that will start to. I am hating the lighting. I want to hide from my lighting. I don't look like I have a
There's
big
nowhere you
white
can
ring on the
go.
forehead. Yeah, I know. It'll start to fill in. The color will start to fill in. Maybe move back more. I'm not sure. Or those lights maybe on more. They need to be turned up. They turn it. My mom knows how to do it. Patty, can you turn off that? Thank you.
Starting to relax my hips.
So isn't that funny? She says that as I put my hands on her hips, this
Yeah.
is the kind of stuff that shows up with this work.
Totally.
Is I'm aware of her whole body and I don't have a point of view about where my hand goes. I know she said it was her elbow, so we started there, but it could be now she's really starting to move. But she missed because there we go. So that was really cool, but the video stopped for a second. Maybe that will be on the recording. I think that's better with those lights. Yeah.
It's that light.
There's a light. Turn it down.
Like I'm even feeling unwinding in my ankle, my right ankle,
You can't see her ankle on the screen, but it's moving around.
and my sacrum.
Yeah, so maybe we should take that back more so they can see her whole body.
Like there's an intensity under my sacrum
Yeah, that's
right now.
so she's talking about her sacrum. So if this was a full session, a full hour, I would probably look at that. Maybe I would turn her over. There's some other sacral release stuff that I have available that I can do. But this is still working. I'm not going to change this. This stuff in her hand is still quite intensely changing. I'm going to go to her thumb now. She says she's
Yeah.
a body worker.
Wow, there's a lot going on.
And now I'm going to do something where I put pressure in between 2 points to create a tension. I'm saying tension, but what I'm actually creating is an invitation from what I'm aware of. I'm inviting the body to show me how it can change and to change. I'm not going to force it. You can't force it. That's the beauty of the question and the possibility when you're being that way. Because if something won't, if you can't force something to change, you just can't.
My back just cracked too.
She's really good. She's letting you know all these cool things that are happening. The play-by-play.
There's a comment. My
Okay.
back started to bubble. I don't know what it's saying. Awesome.
Okay, did you guys hear that? Hiroko just got, there's a question that said, my back is starting to bubble. Someone online. Who was it that said that?
Chris Viv CF.
Yeah, so my back is starting to bubble and what?
I wonder what it's saying.
I wonder what it's saying.
Awesome.
The bodies that see other bodies receive this get really excited about it. There we go. So she's starting to show, her body moved into this position where her knees are going over, if you guys can see that. And I'm now going to contribute to that movement. And this is going to be working on her sacrum, she said. So the sacrum is the bottom of your spine, where your hips are, between your hips. So I'm going to be, this hand still wants work. Or hand, arm, elbow. It's more back into it's the armpit where I'm working now.
Oh yeah, my shoulder just cracked. See?
And how do I know that? Okay, how do I know that? Because I can feel through my hand and through my whole awareness that in her armpit, in her shoulder joint, which is where your armpit is, there's something that's starting to change. It brought my awareness there, brought my attention to that place. This still wants something. So this is a good chiropractic adjustment angle. Good chiropractic adjusting angle. Cool. There we go. You see that? Oh, really? I'm in the way. I apologize. Okay. Yeah?
Yeah. Now it's like my whole shoulder.
So I want to go in a little bit more into the arm. A little bit more, which probably you won't see so much. You see my cool shoes though. Not everyone can.
That's important.
Rock a heel while they do. I would usually sit on a chair beside them, but the set doesn't let me have that possibility right now. So right now I'm just kind of searching with a curiosity where it's tight in her body, where in this area there's a,
Oh yeah.
and what doesn't seem to move with ease, so I'm kind of moving her. You can see that. There. And it's this side that's more painful. So I got my hands, I have my hands wrapped around her elbow, kind of holding onto the bony spots, the joints, the epicondyles, and I'm
Well, plus my chiropractor said that it's not articulating properly.
that's good, I'm glad he
So
said
that's
that.
a point of view. Right, and then he adjusts it and it hurts, but then it moves better, and then it tightens back up and doesn't move.
It's not, the chiropractor that she sees has decided, or said it doesn't articulate well, it's sore in there.
It's sore in there. Yeah. Do you want your stool?
Shh, you receive, be quiet.
Sorry.
I just don't want you to move as much. I'm pulling her elbow.
Do you want me to straighten out, Mike?
Just to let it slide.
I'm gonna straighten out.
There. That's
Yeah.
good? Okay.
Yeah.
This is not a technique I teach in the class. But you it might show up because I'm just creating space in her elbow. And her body likes it a lot. She's very happy.
Yeah, there's something
If you
with
can-
my bicep that the pinch that or pressure. It's good.
I'm leveraging my hand to open up your elbow joint in the back.
Wow.
But her body isn't, like, this is a position her body is quite happy with me moving into. It's intense, but she's like, oh yeah.
Yeah.
And I can perceive that with my body also.
Yeah, and there's a slight burn, like at the back of my
Okay,
elbow.
so there's a slight burn. Can you guys hear Amy when she talks? Because she's kind of talking to me. Yeah?
No, no,
No.
no.
Okay, so she said there's a slight burn,
There we go.
and it just changed.
It just opened up.
So when the fascia, when you're working with fascia, it can have that a burning feeling. It's very so.
Yeah, subtle.
And it can be intense. But the fascia is one of the most highly innervated organs in our body. It has more nerves. Proprioceptive, nociceptive. So where you are in space, and pain neurons. than anything except for your eye. Your back of your retina is the only organ that has more nerves. Interesting trivia question. They do still do Trivial Pursuit. You get that question. Fascia has the most nerves of any organ in your body except for the retina. So you will feel this. You have a lot of sensation in there. It gives you a lot of information about the world around you. So you were perceiving that.
Yeah.
Cool.
Very cool.
Anything you want to sit up?
Yeah.
So that's an elbow.
Yeah.
What time are we at? Oh, I said it'd be about an hour. Okay.
Yeah.
So why don't we
Thank you.
take some questions from the audiences? If you guys have any. You guys have any?
Thank you.
Here's the question.
How was that? So how's your elbow? Let's see how she moves her elbow.
Like, it feels really good.
Can she do the princess way?
Probably
Yeah,
not.
see? Hi everyone. We gotta look at that because that's the
Okay.
camera.
Okay.
Hi everyone.
It just feels more smooth and like fluid.
Yeah.
And like looser.
So that's a couple minutes.
Yeah. Thank you.
Yay!
So Glenna, question here.
Okay. Question. And say it loud enough, or I'll repeat that if you can't. Question in the audience. My audience is over here.
Will this treatment also help hardening of the arteries and valves around the heart?
Oh, that's a good question. So, will this help with hardening of the arteries or the valves around the heart? I would say it could. Now, the one thing that I always have to, I can't diagnose and treat someone that's not even here that doesn't have it, and every single body is unique. And can it contribute? Yes. Points of use people have can be so powerful, I can't change anything with that. Nobody can, because they're actually choosing to create that. There'd be a lot of other things that I might look at if someone came in to me and they had arthrosclerosis. I didn't say that well. And that's when things start to solidify, and it's like the fascia, and then it starts to calcify, because if you get really, really, really dense fascial adhesions, they start to calcify, and then you get things like bone spurs, hardening of the arteries.
Stiffening.
I just worked with someone who had, why did they have the restrictions? But it was starting to calcify in their abdomen. Oh, it's a uterine thing. They're starting, the solidities in there are starting to become so solid they're starting to calcify. And saying that, bone is one of the tissues that turns over the fastest. Like every 3 months, your bone is all new bone. Your skin is all new skin in a week or so. Your body is always, always, always continuously transforming and making new cells, almost everything. Heart's a little slower. It's like 7 years or something. I'd have to look it up. Some neurons are kind of with you your whole life. But most of your body is changing over all the time. Bone is every couple months. Like you have all new bone cells. Your bones are like a 3-month-old baby at their oldest. At their oldest, your bones are like a 3-month-old.
Wow.
So if your body starts to lay down bone somewhere because it's solidifying, it always has the potential to remove that bone also. And I've seen bone spurs go away with this work on the feet. Bone spurs, heel spurs, those kind of things that come from this fascia on the bottom of your foot getting more and more solid. And then you can open it up, it becomes more elastic with the work, and slowly the bone spurs start to melt because the body doesn't require that density anymore because it has its fluidity back. And there might be points of views around the feet that we have changed using these amazing tools, these access tools over the time, and being the question with the body. So thank you for, I have not specifically had a patient that said, I don't have arthrosclerosis anymore, so I couldn't tell you. I mean, I don't have any great examples, but that anyone's ever spoken to, but I've seen so many different miracles happen just by changing your point of view about things. Things that seem unchangeable in the body are changeable. My life, my practice, my classes are full of miracles. Every day. Every time I teach, they're just, in fact, miracles are my new normal.
Yeah.
Then they are that way because I just don't even like. It's like something you changed all this, and I'm like, yeah. So sometimes I have to just remind, how does it get any better than that? A little bit more. One of the great access tools.
Tiki has a question.
Is there a question online? Tiki from Japan? Is it
Yeah.
written, or are we going to have a translator?
It's not written yet.
Okay. We have Yaso as my Japanese translator.
There's a question in Spanish too.
About
Okay.
Japan first. テキテキちゃんどうぞ。早く早く早く。
はい、こんにちは。筋骨格でもなく、筋膜というのは、体の中に包まれているものっていう、感覚があったんですけれども、筋骨格でもなく、臓器でもない、皮膚については、いかがでしょうか。もし皮膚について何か問題があった、クライアントに対しての施術のご経験などありましたら教えてください。よろしくお願いします。
Can you turn off your translator mic or one of them because there's an echo? Or just mute yourself now, and Yaso can translate your question. That was long. He's good. He's a good. He's an amazing translator. So yes, what is the English version of that question?
マキちゃんがやるんじゃなかったっけ？俺やる？
I will. I'm your translator, Glenna.
Maki. I keep.
I understand. Wait, I'm just gonna mute myself a little.
Tiki needs to mute herself.
So I understand fascia is like it holds everything, your organs.
Hold
Can
up.
you hear me? Okay.
There. Got it. She's muted now.
My understanding is that fascia holds everything in place, like organs and bones and muscle tissues. But I was wondering, how about your skin? Have you ever worked on a patient or client who had like skin issues through fascia? If you have had that experience, I would like to know about it.
Well, scarring on the skin and the face is, I've seen fabulous results. In fact,
sorry.
Yeah, it's okay. There's someone here in the room that came into an EMT class that had a scar on her face that changed dramatically during the class. I think we have before and after pictures from that class, but
I think so.
and I'm seeing her a couple years later, and it's still made. This stuff doesn't come back. That's the cool thing. One of the things about this, like you when you release fascia, if you can create that stuff back again, but it takes a little bit of time. So when scar tissue changes, and the cool thing about scar tissue is you can see a lot of the scars, so you can actually see visually the change during classes. Other things with the skin, stretch marks I haven't had a lot of luck with, but some people have reported they've gotten some changes, so I'm changing my point of view about that. I personally haven't had a lot of luck with changing stretch mark tissue. Someone with a lot of acne, people have had better results. And acne scars, definitely, you can work on each scar individually, can change. You start opening up the fascia in the skin, because yes, skin is fascia with skin cells in it, right?
Yeah.
Your muscle is fascia with muscle cells in it. That's the way I see the body. The body is fascia with all these other cells in their proper places all through the body. So if you can open up the fascia, everything works better. So if you have something like eczema, you open up all the tissue, the fascial tissue, then the cells can function better because they don't have the straitjacket around them. So the blood can get to them, the toxins can get away, everything can start to be better. And you can sometimes have really intense changes with the skin after fascial work, like it can increase the irritation and then it can go away and things can get better just like as the toxins or the body detoxifies when it gets this more space, the more space to move. Everything the body needs to move around all day, like all of the, I want to say the blood, but it's also the tissue, the interstitial tissue fluids that need to move around your lymph system. And the lymph can be affected massively because the lymph is fascia with lymph in it. You open up the lymph, the fascia around the lymph systems, and you get all of the fluid can start moving better. And I find with obvious scars people have, when you open up those scars, swelling can go down in other areas because the fluid can start moving, flowing. So great question. Thank you so much. Thank you so much for that question. Now there was a Spanish question. Bruno. We don't talk about Bruno. Sorry.
Yes.
I can't not hear that song when I say it. Quite
Yeah, me too. There was someone saying in the Spanish thread, how do I know if I have a problem with the fascia? What do I have to put my attention on?
I've not been asked a question that direct about it. How do you know? If your body's more stiff than it's been usually, if it starts to get stiffer, like in the morning you wake up and everything's stiff, doesn't move as well. If your range of motion, like you used to be able to lift your arms up and they don't quite go up, you used to be able to touch your heels to the floor, that might be it. If you have scarring, usually you've got some fascial stuff around it. The scar is usually the tip that you see, like the tip of the iceberg, and the rest of the stuff is all around. And everyone has points of views and judgments. So I've never worked on a body that was, except for maybe babies and very young children, that has really have just fluid fascia everywhere. And I say in classes that our body should feel like a toddler or a baby throughout our life, have that kind of bouncy quality you find with children. Usually at around 8, 9, 10, some of that starts to go away with the world around us and the judgments that get impacted into our body. You may not feel anything, like our body will accommodate fascial stuff, so you don't really know, you feel kind of fine, and then you get a session and you realize, whoa, all this movement I didn't know I had. I went to my first class that was working with fascia, and I had a leg that was a little different in length. I'd been used in physical therapy school as the example of that. I didn't think it was, there wasn't really much I could do. That was my point of view at the time. Brand new people in a brand new class, novices working on me. In 3 days, I remember standing in front of a mirror with slats in the closet behind me at this hotel in Hawaii. It was quite a fabulous trip. And I was looking at my hips that were always a little bit different. But I was fine. I didn't have much pain. I had a little back pain from childbirth, but didn't walk around with any problems that I knew of. And I'm looking at my hips and they're even. They're totally level. And I'm like, that's weird. And this was so bizarre to me at the time. I turned around and looked at the slats in the door behind me to see if they were crooked. So I was fine. I mean, I wouldn't have ever gone to I wouldn't have gone to a therapist for anything. I didn't have any pain in my body. But afterwards, I started walking different. That little bit of lower back pain I had experienced on occasion after I'd had my son and daughter. I had 2 kids at that time, and it was just gone. My hips moved. I could move better. I had a history of, I'd been a dancer for years, did lots of training in ballet and contemporary dance. Went to regular classes, and I go to the class and my leg goes higher. Like it's going up, my leg is moving like it did when I was in my early 20s, and now I'm in my mid-30s at this point. So I wouldn't have known necessarily that there was something going on. Now, after getting all the classes and the work, getting yourself treated, or seen treated is a weird word, getting yourself worked on regularly, receiving this work regularly is a great, great way to gift to your body. Problem or no problem. It just starts to function more easy. If you have things that are kind of tight, your muscles have to work really hard all day long to keep you in a good posture, to walk through the world. If you don't have to fight these tightnesses and these things that solidified with judgment, you have more energy. But you may not be experiencing anything obvious. It's kind of like after the work, and people in classes will, I don't know if you guys, any of you notice that after the class, you're like, oh my God, I didn't even know. Mm-hmm. I didn't even know. My back, I didn't know. Because it's not, your body's going to accommodate this, and your body will do its best to function at the highest quality it can. Which I've seen, and I've had a lot of experience. I worked with kids with cerebral palsy for years, and I saw their bodies function as best they could with the stuff that was going on with their bodies. So bodies are amazing and will do the best they can with what's available, so you may not notice. And the most amazing body ever that I've ever worked on, which I couldn't tell you who that is, gets benefits from this work. I've never had anyone go, oh God, nothing changed. I've had people that can't notice it right away. They tend to have less awareness with their body. And then I work with that, and then they start noticing the change. So I hope that helps your question. Does that help, Bruno? Is that something, did that help? Yeah? Okay. Sweet. Anything out here? Any other questions in the audience? Any questions for me? So this class was inspired by some of my upcoming classes. I'm traveling around the world teaching EMT. There are no prerequisites for this class except for having a body. We will post wherever this is linked where classes are. You can go to drglennarice.com/EMT, and in there's a link really easy to get to. You can click on to see where I'm going next, which New York, Ecuador, and Tokyo. Quito and Tokyo are my next 3 that are scheduled. But that will change depending on when you're watching this video, which could be years into the future, or it could be right now live. I love this work. I hope that came through. Bodies love this work. I'm very blessed. I'm very grateful I'm seeing people doing sessions. I'm seeing videos and posts and stuff all over the world where I have taught classes and speaking about the magic that I experienced when I first started doing it, and it's such a gift to me to see that. I know Bruno, who is translating, has had some cool videos. There's a wonderful man. Anyway, I'm not going to go into details about who they are. Just I'm so grateful that people are touching bodies with this work, and one of my targets is that if people that desire this work can find it, that there is practitioners all over the world for people looking for it, and people that come to the classes that want to create businesses can create amazing generative businesses. And the people that just want to receive magic for their body and this will contribute to them will find it. So, is that good, guys?
Yeah, thank
Good?
you.
Okay. I think yeah?
People are asking, when are you going to Mexico?
Well, I don't know.
Let's chat later.
I have done this class in Mexico at this point, I think 3. My very first, I have to say, I love Mexico, grateful for Mexico. And my very, very, very first official EMT class was in Mexico City. So I will be back to Mexico. I just need to be asked. I need to be asked, I need a venue, and I need people. And then I can...
はい、じゃあ面白いですね。Come to Japan.
I am coming.
It's in February. No, I'm talking to Bruno.
Yeah.
Bring all the Mexican people.
Good idea. Yeah, I mean, I can fly everywhere if there's people, time, and space, but you could also, travel to classes. I always find that quite fun to get on a plane, get a hotel in a cool city. I usually have my classes in cool cities, so I don't have to fly to you. You could fly to my classes too. So there is cool places. So go to my website to see where I'm going next. And maybe that would be a fun trip. And then you can get some body work too. And then it's like, for some people it'll be a write-off. I don't know. The possibilities are endless. What else is possible you've ever imagined? What is possible with your body you've never imagined? And what contribution can you be and receive from your body that's greater than anything you've ever considered possible? Adore you all. Thank you for listening. And hopefully I'll see you live somewhere on the planet. Yay! Yay!